The joys of working in mental health are all about making a difference. We try and make sure that we always keep our patients at the center of everything we do.
It's such an interesting experience to be able to be part of someone's internal world and to be able to walk with them through the journey that they're on.
We've spent a lot of the last few years embedding more staff into clinical services, particularly in the community. The Royal Commission set us on an ambitious reform piece. We've come a long way in expanding our community teams, making sure that consumers and carers in our community have a wraparound support from every discipline.
I used to work in construction. I had this inner realization that I want to do something meaningful, and that's when I joined. Since then, I haven't looked back.
My role is around embedding lived experience workers into all community and inpatient teams. I have a personal experience of living with a mental illness and recovery.
I support my wife, who has gone through her own mental health trauma and mental health recovery journey. This work brings a really unique perspective in terms of walking alongside a family member and having your own experience of supporting a loved one into the mental health. It has a whole different feel, and it's about connection.
When we're meeting with someone, we're usually getting to know them and find out what has brought them to a mental health service. So we kind of step outside of the mental health lens as much as we can. One thing we do really well is we help people navigate the system, and we kind of bring a little bit of reassurance to people.
I'm looking after the whole aspects of the person's life, the medical part of it, the psychological part of it, and the social part of it, to know them as a person, to understand them. It's a quite rewarding job.
We want people who are passionate about the work they do. We want people who have evidence-based skills to bring to our teams. And we want people to grow and spend their time at Austin with a huge breadth of services that we have on offer.
At Austin, we provide mental health care across the whole spectrum of ages and services, which range from acute and crisis care to inpatient and community services. But we also have a range of specialist services, including the psychological trauma recovery service, the brain disorders program. There is so much scope here to learn, grow, and specialize if that's what you're keen for.
This centre has ability to admit up to 3 families with children under the age of 12 who have experienced some form of trauma or are starting to experience some mental health concerns. Buk Buk Narakwa Nawa Jawa Nun means family healing in the Wurrung language. We work with the whole family about healing and connecting.
Every day is different, every day is exciting. Being part of a learning, teaching hospital, you're going to be doing the best evidence-based practice by your clients.
In terms of psychology, there's so much variety that you can get at Austin Health and in public mental health generally that you can't get as well in the private sector.
You get to learn so much from the senior people around you. You feel really secure in the job in the sense that you're a part of a really big community.
Austin Health's always been really flexible around family needs and taking time off or working part-time, and it's always been really easy to get what I needed to be able to support my family.
It can be quite stressful at work at times, but it's good to know that in the background that there is support there through the consultant psychiatrist or the nursing staff or the manager. I find that they're always very approachable.
There's lots of training and supervision, but what I really value is kind of the informal support we get, whether it's a cup of tea or someone checking in on you.
To be able to work with people who are at risk and to do so in a respectful way that promotes their dignity, promotes their strengths and helps to normalise that we all experience some sort of mental health issue throughout our life, it's really, really satisfying.
I find it really rewarding working with young people and their families from a time where they don't have a lot of hope and we're the ones that hold it to a time where they can see the great things that can happen in their future.
We hope that consumers and carers feel like the system's a bit more easy to navigate, that they don't have to wait till there's a crisis before they can contact us. And we really hope that our services now provide a more seamless delivery of service for consumers and carers. We'd love you to come work with us.